Welcome to Musculoskeletal Sonography, Introduction and Normal Sonography. The intent of this lecture is to introduce you to musculoskeletal sonography and to provide a general understanding of its application in veterinary medicine. After this lecture, you should be able to describe the general approach to sonographic examination, and you should be able to describe and recognize the normal sonographic appearance of tendons, ligaments, muscles, and bones. There's no expectation of describing or naming anatomy of specific regions, for example, naming the structures of the shoulder. Musculoskeletal sonography is routinely performed in human patients, and historically it was relatively underutilized in veterinary patients with the exception of horses. However, it is recognized as a complementary and cost-effective alternative to MRI and CT, so is more recently being utilized in dogs and cats, and it is particularly useful for soft tissues when combined with radiography. Ultrasound is more accessible and mobile than other alternatives. It is cost-effective. Often, no or minimal sedation will be needed to perform our studies, and it allows for dynamic assessment of joints, ligaments, and tendons that cannot be done with CT or MRI. Finally, we can guide sampling and some therapeutic interventions. In trained hands, ultrasound may provide the same or superior information to CT and MRI. There are some challenges that come with ultrasounding the musculoskeletal system. Certainly, this is a complex area that requires a very thorough anatomical knowledge that is specific for the region you're imaging and may be more specific for the species. The size of structures in our smaller patients, particularly those smaller than 15 kilograms, in combination with the ultrasound system performance and the complex anatomy, can prove difficult and challenging, and there are artifacts that can be confused with pathology. Finally, once we identify potential lesions on ultrasound, clinical correlation is imperative. So we can evaluate the soft tissues such as tendons and ligaments, the muscles, we can evaluate skin and subcutaneous tissues, and we can even evaluate nerves with ultrasound. We are able to evaluate some structures of joints as well as bones, and we can guide interventions as stated earlier. We are going to talk a little bit about a general approach to the scanning technique, but you should recognize that the exact scanning technique will be dependent upon the species as well as the body part. And so it will be imperative for you to consult references such as textbooks and the literature. On this slide, I have the covers of 3 of the textbooks that I like, the 2 on the left for small animal and the 1 on the right for large animal, and then again, or for specifically for equine. And then again, there will be many papers out there for different body parts of different animals. In general, you should always choose a high-frequency linear transducer. These are definitely preferred for musculoskeletal sonography. A standoff pad may be beneficial to evaluate more superficial structures or to evaluate curved structures. And then, although we like the high-frequency linear transducers, we may need to choose a curvilinear or microconvex transducer when we are looking at smaller curved surfaces or need a lower frequency for some deeper portions. The image on the left is the setup I have in small animal, where I typically choose the center linear transducer with a higher frequency and a smaller footprint, but we have a little bit lower frequency transducer with a larger footprint, and then we have our general kind of microconvex transducer that might be beneficial in certain areas. I will acknowledge that my musculoskeletal sonography experience is small animal, and so most of my examples will come from small animal. However, we'll try to include a few examples from equine as well. And the 2 probes here on the right are example probes from ultrasound setups for equine sonography. The linear transducer is preferred for a few reasons. The first is that it provides higher frequencies, but then it also provides a wide superficial field of view. If you remember, the linear probes have this rectangular scan field of view, and that also allows for the uniform angle of inclination across our scan field of view. So we will get a similar appearance to our image from one edge to the next. Whereas the image on the right is of a microconvex transducer. If you remember, this has a sector or pie-shaped scan of view, and because we don't have a uniform angle of inclination, we'll start to lose some drop off as we get out to the edges of our field of view. But remembering we have a smaller footprint, so we might have some benefit in certain areas. We may or may not need any sedation. I do want to caution you that a still and relaxed patient does definitely facilitate detailed and thorough examinations, and some of our dynamic studies may be painful as we put the patient through range of motion, so I do like to have some sedation to help us with our imaging. The area to be scanned should be clipped and cleaned, and in horses, especially of the distal limb, we may need more thorough cleaning. We will apply a wetting agent such as isopropyl alcohol, and then we will use ultrasound gel. Our structures will typically be scanned in both longitudinal and transverse planes, and it will be very important to image as perpendicular to structures as possible to minimize artifacts. Our dogs and cats are generally scanned in lateral recumbency with the limb to be scanned, generally non-dependent, while our horses are scanned while standing. Limb positioning is often altered, and that's going to be dependent upon the structure being imaged. So for example, in the dog's shoulder, we will externally rotate or supinate in order to assess the biceps tendon. And we may image in flexion, or we may utilize dynamic imaging to assess for adhesions or other pathologies. As I mentioned, artifacts can be problem with musculoskeletal imaging. So the first artifact we should remember is our acoustic shadowing, and if you remember, that is our anechoic zone that we'll note beyond a highly attenuating or reflective structure, and that is due to reflection, refraction, and absorption of our beam. So this is an example where we are imaging the highly reflective tuber calcanei as indicated, which be that bright echogenic linear area, and then the large arrows are indicating our acoustic shadowing. Another artifact is anisotropy, and this is a region of decreased echogenicity that is caused by oblique positioning rather than perpendicular positioning of the probe on the body part imaged. And in this image of the biceps tendon, the tendon should be hyperechoic, and we see indicated by the large arrows this decreased area of echogenicity, which is the artifact anisotropy. When we move into talking about the normal appearance of our musculoskeletal structures, one thing that you should keep in mind is that the sonographic appearance of structures is really pretty similar across species. These structures will have characteristic echogenicity, echotexture, size, and shape, which will be the basis for diagnosing injuries and other disorders. And again, knowing all the differences across species and for different parts is beyond the scope of this lecture, and so you will learn about that in particular courses you might take, or if this is going to be something part of your practice, then you will just need to have those references available. So when we look at tendons and ligaments, let's start with the longitudinal plane. And we're going to use tendons for our example, but remember that ligaments will have a similar appearance. So in longitudinal plane, the tendon will be moderately echogenic with moderately echogenic echotexture, and it is composed of hyperechoic fibrils, which are these hyperechoic lines that are multiple and parallel. And we will oftentimes refer to this as a fibrillar pattern. So this is an image of the canine infraspinatus tendon located in between the larger arrows, and if you notice these nice bright parallel lines here of the fiber pattern. In transverse plane, most tendons will appear more uniformly hyperechoic, and that is due to the multiple small internal echoes that are the fibers that we saw on the longitudinal plane. So this is a transverse image of the biceps tendon, as indicated or outlined by these arrows, and we can see that the tendon itself is more uniformly hyperechoic. We may be able to see a nice thin hyperechoic outline around the tendon, which would be your peritendinum. Now, tendons and ligaments that have fanning fibers are oriented obliquely to our imaging plane. So, for example, the cruciate ligament, and those are usually hypoechoic, mainly due to that artifact anisotropy. Some variation from expected will happen, and specifically that might include the equine suspensory ligament, because that ligament is also composed of muscle tissue, connective tissue, and or fat, and so it will be much more heterogeneous. So let's just go through a few general examples. So I have a longitudinal and transverse image of the dog's biceps tendon here. And so on the left image here, we have the longitudinal image of the biceps tendon originating from the supraglenoid tubercle, and then this margin is the humerus, and again that tendon will be nice and have little multiple hyperechoic parallel lines. In the transverse image here, we've got the greater tubercle and the lesser tubercle, and so that oval shaped tendon that is more uniformly hyperechoic will be in the intertubercular groove. Here are images of the dog calcaneal tendon, longitudinal image and transverse image. And the dog calcaneal tendon has more components that we can outline here. We can see the superficial digital tendon, the gastrocnemius tendon, and the common calcaneal tendon components. And then on this longitudinal image, we'll also see a little bit of bursa and connective tissue. The fluid in the bursa will generally be anechoic, and the connective tissue will be moderately echogenic. Again, we can see the tuber calcanei here with its acoustic artifact below the acoustic shadowing. And then on transverse, again, we can see our components of the tendon. And then for an equine example, I have a longitudinal and transverse image, which we will depict the superficial and deep digital flexor tendons for you. Again, in longitudinal image, we can see these nice parallel hyperechoic lines, which is our fibers, our fibrillar pattern. And in transverse image, you'll see more finer speckling in these tendons than we did in the dog because they are larger fibers. Again, depicting our superficial digital flexor and our deep digital flexor tendons. Now, if we take a look at muscle, in the longitudinal plane, the background of muscle is hypoechoic, and then there will be fine oblique hyperechoic striations that are noted within that hypoechoic background, which represent connective tissue between our muscle fascicles. Again, the muscle is hypoechoic. And then the outer margin of the muscle, as depicted by the orange arrows here, will also be hyperechoic because that's the fascia. So this is an example of the supraspinatus muscle in longitudinal plane in a dog. In transverse plane, again, we'll see the hypoechoic background of the muscle fascicles, and then we'll see echogenic foci, less kind of oblique striation that gives a coarse echotexture to our muscle belly, which again here the supraspinatus muscle in a dog is outlined with the orange arrows. We can see here the hyperechoic linear echo from the spine of the scapula with acoustic shadowing. Here's an example, a longitudinal and transverse image of our dog infraspinatus muscle. The muscle here is outlined as I show you in the arrow. And again, we can see this nice oblique striation in the hypoechoic background. These oblique striations are going toward the central tendon, and we saw tendons before. Remember, they are more uniformly hyperechoic. In longitudinal, you might notice the linear fiber pattern. And in this muscle, oftentimes we might talk about the fishbone pattern that we can see in some of these muscles from those oblique striations. Here's a transverse image. Again, we have more hyperechoic echoes as they go toward the central hyperechoic tendon of the infraspinatus muscle. Here's transverse and longitudinal images of the supraspinatus muscle, again with that hyperechoic pattern that is on top of our hypoechoic background. The left image here is a longitudinal image of the biceps muscle of a dog, and then this is a transverse image of several of the brachial muscles, again hypoechoic with that kind of hyperechoic striation or echogenic foci depending on the longitudinal versus the transverse imaging. Moving finally onto bone, the surface of the long bone is typically examined in longitudinal plane in order to enable an examination of a larger portion of the surface of the bone, and that can actually allow us to compare the area of interest with the adjacent normal portions. The normal bone surface appears as a smooth, hyperechoic, continuous line, which then has acoustic shadowing, very strong, due to the reflection and absorption of sound waves. Depending upon the bone and where we're imaging, we may see some reverberation artifact, and then the surface of the bone will be slightly more irregular at sites of origin and insertion of joint capsules, ligaments, and tendons. So a few examples here. I've got a longitudinal and transverse image of the humerus of a dog. And so in longitudinal image, we see this nice hyperechoic smooth line of the humerus and then very sharp acoustic shadowing. On transverse imaging, we see this curved hyperechoic smooth interface of the bony cortex with the strong acoustic shadowing. Here I have a longitudinal image on the left of the radius. Again, nice smooth surface of the radial cortex with acoustic shadowing. And then as we move from the radius more proximally, we can see the radial cortex gets a little bit more irregular, where we have a radial tuberosity, and then we have the radial head, which is more curved. We can actually see a little bit of joint here, and then we have the humeral condyle, again nice and hyperechoic with acoustic shadowing.